A child presents with soft, weakened bones, leading to deformities such as bowed legs. The child has a history of vitamin D deficiency. What is the most probable diagnosis? The answer is Rickets. A deficiency in vitamin D leads to soft bones. A patient reports frequent loose stools, abdominal cramps, and dehydration after eating a meal at a restaurant. What is the most likely diagnosis? The answer is diarrhea, a common result of infections or food poisoning. A patient experiences stomach pain, bloating, and diarrhea after consuming milk or dairy products. The symptoms improve when these foods are avoided. What condition is this? Lactose intolerance it is. Symptoms arise from the inability to digest lactose. A teenage girl is extremely underweight, restricts food intake, and has an intense fear of gaining weight despite being thin. What eating disorder is this? The answer is anorexia nervosa. It's an eating disorder marked by extreme weight loss. A middle-aged patient reports joint pain, stiffness, and swelling, especially in the knees and fingers. What is the most likely condition? Arthritis causes joint pain and inflammation. A patient experiences excessive thirst, frequent urination, and weight loss despite eating regularly. A blood test shows high glucose levels. What condition is most likely? The answer is diabetes mellitus. It's characterized by high blood sugar levels. A person who has smoked for many years is experiencing shortness of breath, especially during physical activity. A lung function test shows that the air sacs in the lungs are damaged. What condition does the patient have? Emphysema is a lung condition often caused by smoking. A woman in her early 50s reports irregular periods, hot flashes, mood swings, and night sweats. What is the most probable cause of these symptoms? The answer is menopause. It marks the end of a woman's reproductive years. A patient presents with a persistent cough that produces mucus, chest tightness, and shortness of breath. These symptoms started after a bad cold. What condition is this likely to be? Bronchitis is the inflammation of the bronchial tubes causing cough. An elderly patient is experiencing memory loss, confusion, and difficulty recognizing familiar people. What is the most likely condition? The answer is Alzheimer's disease, a progressive condition affecting memory and cognition. A postmenopausal woman complains of back pain and frequent fractures after minor falls. A bone density test shows that her bones are weak and brittle. What is the most likely diagnosis? The answer is osteoporosis. It weakens bones, making them fragile. A patient suddenly becomes unresponsive and has uncontrollable shaking. The episode lasts a few minutes, followed by confusion. What condition is this likely to be? The answer is epilepsy. It's characterized by recurrent seizures. A patient complains of extreme fatigue, darkening of the skin, and low blood pressure. Blood tests reveal low cortisol levels. What is the most probable diagnosis? Addison's disease is a disorder of insufficient cortisol production. A 60-year-old patient shows tremors, slow movement, and stiff muscles. These symptoms have gradually worsened over time. What is the most probable diagnosis? The answer is Parkinson's disease. It leads to tremors and movement difficulties. A person feels sharp pain in their side and lower back. Tests show small, hard deposits in the kidneys. What is the most likely diagnosis? Kidney stones are the painful deposits that form in the kidneys. Thanks for watching and hope you enjoyed.